Okay, we are going to learn about post-op teaching. And post-op teaching starts with breathing, deep breathing, and coughing. So we're going to position the patient, fowlers or semi-fowlers, and they're going to be practicing diaphragmatic breathing, which is placing their hands on the lower rib cage, midline, the fingers on the midline. Basically, what they need to know is that this is going to expand. Uh, Feel how that expands. So they're going to breathe in through their nose, actually, and breathe out through their mouth, and they're going to hold it for a couple of seconds. They're going to do some coughing, 2 or 3 times diaphragmatic breathing, and for coughing, they're going to lean forward. So they're going to repeat this several times, and well, they're going to again breathe in through their nose, breathe out through their mouth, open mouth. They're also going to know about the incentive spirometer. If they're weak, they can use the splint with a pillow or a blanket for incentive spirometer, or even have medication if there's pain. But they need to huff 2 or 3 times if they're weak. So they're positioned upright, and they breathe out, and then they place the mouthpiece of the incentive spirometer, creating a seal with their lips. And basically, they're going to breathe in slowly. We're going to see the gauge rising, and that's going to set for setting the goals. That is what we need to use. And we're going to monitor this. So they remove it, they exhale, but we let them know that it's about 10 times every hour that they have to do this while they're awake. So, and then we're going to use this guy for leg exercises in bed. So the first one that we're going to do is ankle circles. So they're going to dorsiflex, and they are going to rotate clockwise and counterclockwise 3 times, and they're going to do it with both feet. They're also going to do ankle pumps, which is with their leg extended. They're going to do plantar flexion, and dorsiflexion. So they have to have their leg up against the bed, and when they do the plantar flexion, they're going to feel a pull on their calf. So that's the whole point of this. They're also going to bend their knees. So when they flex their knees, the sole of their foot is going to be flat on the bed, and then they're going to do this, like just flex it. If they have a surgery on the other foot, they won't do it. But if not, then they're going to alternate this and repeat several times. So, and that's it for those exercises. Again, we encourage that range of motion and activity. Our patient also needs to know about pain because it helps with the recovery process. So we discussed with the patient about medications, but also some other methods that don't include medication, like guided imagery or changing positions. And we're going to discuss with them what pain is tolerable for them, what is tolerable, and the scales, because there's a few different ones, like numeric or the flag or faces, depending on the age and level of literacy and all that. So that is for pain. But the last part is self-care, which is they need to know about dressing changes, exercises, vital signs. They need to know assessments. For example, the vital signs, the temperature, because it's an indication of infection, for example, and assess if there's any the wound, if it's red, if it's swollen, if it's smelly, if it's open. So those kind of assessments that they're going to do on their own, and we tell them what the rationales for the treatments are also. So they need to know what are the expected results because they're going to be doing it on their own. They need to know about any diet restrictions and activity also that they have to keep up with activity, and they need to know how to report any signs and symptoms, any complications reported to the surgeon or to their physician. They also need to know about any office visits, follow-up appointments, and of course lifestyle changes that they need to make, like quit smoking and walking and whatnot, and community resources like Meals on Wheels or support groups if they need it. So that's post-op teaching.
Okay, so how do you tell Stan how to move in bed?
Oh, move in bed. We are going to teach Stan how to move in bed, how to turn in bed. So Stan has the rail up here, the bed rails, both of them. And if he is going to go to his left, he is going to grab that rail and he's going to flex his foot and push off this way. And on the count of three, 1, 2, 3, and then he pushes and then he turns. But if they can't keep the position, then we put a pillow on their back, so that helps. That's basically how they turn.
Okay, good job.
Thank you.